adolescent females who do not want to wear the device because of peer pressure. I've seen a boatload of these young females, usually between age 14 and 16. They really have the symptoms. Mom brings them in and they are desperate. Terrible headaches, terrible earaches, keeping them up all night. Mom says, you have to do something. You have to do something. Now, the majority of young females in this category jump at the chance of getting rid of the symptoms, no doubt about it, the vast majority. But there's a much smaller minority who you tell mom, well, this is going to fix it. You have to go through the protocol. You have to keep it in 24/7 for 2 months. And I'll discuss that a little in detail a little bit more. I have discussed that in adolescence. You do treat an adolescent a little more carefully than you treat an adult with this device. But the point is, it started out, well, the first time I saw this many years ago, okay, mom says, all right, get your impressions and let's start. And the patient then gets the device, delivered device, comes back in 3 weeks and no better. And you say, Janie, I said, have you been wearing the device? No, I can't wear the device. Well, don't you want to get better? Well, I won't wear the device. Oh, Janie, why won't you wear the device? He said, I look funny. It's the same thing why some children do not want to go through orthodontic treatment or you put anything else in their mouth. They get peer pressure. Their girlfriends don't have to wear a device and they make fun of them. But this is a category that you will see. Now, let me unpack this a little bit, because I learned is how do you deal with this then? Because you as the provider, you as the doctor, you want to see your patients get better. You want to, be the quote hero, if that's what you want, in front of the mother and make sure that you do the proper thing and get the result. But Janie's not going to wear the device, even though it hurts. So number one, I always make a few comments in front of the mother with the child at that point where we're not making any headway, and it's because the child won't wear the device. I say, first of all, I look at mom and I look at Janie, and I say, Janie, I understand you don't want to wear the device. Okay, what I want you to do is I don't want you to complain to your mom at all. And then I'll look at mom, I'll eyeball mom, and I won't say anything more than that. But I say, do not complain to your mom anymore